We see a little bit of writing on the wall, and it's my job in my semi retirement to make sure y'all get everything you're entitled to. If you're currently receiving benefits, you're getting the right check at the right time, you're at the right program. If you're about to file, I give you all the information on how to file. If you're new to my channel, my name is Ed Weir. I ran the third busiest Social Security office in the country, and this is what I'm doing. And my semi-retirement is helping y'all navigate the bureaucracy that is called Social Security and Medicare. This is also a live Q&A. I'm going to go through what we're looking at for 2025, what you really need to know, what you need to watch for 2025. Should take about 10, 12 minutes. And as regular viewers know, I will open it up for a Q&A afterwards. So we'll probably about 45 minutes or so. I'll answer any and all of your questions about all things Social Security retirement. Make sure you and your family are getting everything they are entitled to. Okay, so let's jump right into it. We've got these four individuals that are going to have a big impact on retirees in terms of Social Security and Medicare going in the future. The two of them on the left, RFK Jr. and Dr. Oz, haven't been confirmed by the Senate yet. Elon Musk, it's kind of outside advisor or whatever the situation. It's not a cabinet level position, but even if they're not approved by the Senate, not confirmed by the Senate, these are people that President-elect Trump chose because they had particular policy ideas. So I want to talk about those policy ideas and how that could affect your monthly check and your Medicare that you get. So we've got RFK. We'll go through them. We'll do RFK. We'll do Dr. Oz. We'll do Elon Musk, and then we'll do President-elect Trump at the end of there, and we'll fill you in on what, based on my decades of inside the bureaucratic beast, what it's going to look like for you going forward. All right, but I can tell you one thing 100% for certain, that right now in 2024, and even more so in 2025, people are not going to get the benefits they're entitled to because the whole Social Security system is just way, way too complicated. We're looking at over 20,000 pages of policy, and it's just exceptions to the exceptions, the exceptions. That's why I do this live Q&A on a regular basis, help people make sure they get their benefits that they earned. People are filing for the wrong benefits. They're getting the wrong check. So it's going to get even worse in 2025 because the funding for Social Security is at a 50-year low, and that's just going to get worse next year and the year after. I just did a video yesterday about a congressional testimony of the outgoing commissioner of Social Security that says, hey, it's going to get worse. People are losing money. We need money to hire people to help. And Congress pretty much said no. So it's going to get worse, but I'm going to be here. Make sure you subscribe. I'm going to keep my eye on everything. And if there's any programs coming up that might benefit you, there are any changes that might not benefit you that you need to know about, I'm going to keep you up to date. So subscribe and like and all that kind of good stuff. But I do my live Q&A 3:00 West Coast time. Okay, so like I said, if even they're nominated, but they might have to go through the Senate. I think there's some political maneuvering behind the scenes there, but the changes for 2025 are going to be very, very fast. I've been doing this a few decades. I've seen presidents come and go. Last time was Trump was in office. They had the presidency. They had the House of Representatives under, was it Paul Ryan? They had the Senate, and so they had it all, but they only had it within 2 years, and then they lost the House to the Democrats. This time, I think they're going to realize that they just might have 2 years, so they're going to push things as fast as they possibly can. Some might be good, some might not be very good. So these are changes that are going to happen, possible changes, and I'm going to tell you, up until now, old Marine Corps sergeant, always positive, gung ho. Not so much anymore. So at the end, I'll tell you why that is a fact. And it's not a political thing. It's just the time has gotten by and we haven't done what we need to do. Okay, let's go ahead and get to RFK. Everybody knows about his vaccine ideas and everything. I'm not going to talk about that. But one of the things that seemed positive he talked about the last few days was he wants to reform billing charges. And that sounds really, really boring. It is extremely boring. but it just might affect your pocketbook because we're talking about Medicare, what doctors can charge Medicare. And Medicare has a solvency issue just like the Social Security Trust Fund. And if it gets difficult in the future, then they're going to have to cut back benefits and provide less benefits. And he is saying the American Medical Association has kind of a monopoly on choosing how much doctors are paid, and they want to maybe change that. He wants to go ahead and change that. So that sounds like it might be make it cheaper for everybody. And he says one of the things at the AMA, they really like specialists rather than general practitioners, family doctors. And because of that, there's not that many family doctors out there that you can find. I know personal experience, that is a fact. Um, and because everybody wants to go into specialists because that's where all the money is, because that's where the AMA likes the money to go to. So if they change that billing, maybe there'll be more family doctors in the future. Another thing he's really big on alternative and holistic approaches to health, healthy eating and all that kind of stuff. So there might be some more benefits within Medicare under that. All right. So we don't know. So he's going to be in charge if he's confirmed the Health and Human Services. Under the Health and Human Services is CMS, the Center for Medicare and Medicaid Services, and that is going to be Dr. Oz if he gets through. The big thing on him that everybody's worried about is that even on his show, if you ever watched his show, he always pushes Medicare Advantage. So his solution, perhaps that's why President-elect Trump chose him, because they always wanted something to replace Medicare and replace Obamacare, and make it Trump care. And he had a beautiful plan supposedly, but the plan never materialized. And maybe that's why he chose Dr. Oz, because Dr. Oz has a plan, and his plan is basically Medicare Advantage for all. So he would take the current Medicare Advantage system and just give it to everybody. Some countries have that, and it's pretty successful. So it really depends on how it's run. But the things that everybody, if you're new to my channel, you probably don't know, but the regular viewers know I always, always, always recommend Medicare supplement plans. So if you have Medicare at 65, or if you got Medicare because of being on disability for 2 years, at I always recommend Medicare supplement plans, the Plan N or the Plan G. Older people have the Plan F, but a Medicare supplement, because you don't have networks, you don't have prior authorizations where the insurance company gets in between you and your doctor. That's why people shy away from Medicare Advantage. If they were able to address those issues and the fact that Medicare Advantage cost the government more when it was supposed to save money, then those kind of three issues need to be solved if we're even talking about Medicare Advantage for all. Again, networks need to be addressed and pre-authorizations. But I tell you, Medicare Advantage, the Part D plans in 2025, there's more changes this year than there have been for decades. This is a crazy year. And because of it, I've partnered up with a group, Chapter Medicare. There's close to 2 million Medicare Advantage plans that have been canceled for 2025, millions more that have been downgraded to such an extent. If you read the fine print, you would cancel it. So if you've got till December 7th. So this is a big thing for 2025. If you get stuck in a plan you don't like, you're pretty much stuck in there for 2025. There are exceptions. But I know there's hundreds of thousands of people that don't realize their plans have been canceled or downgraded terribly. So reach out to Medicare, to Chapter Medicare, and they can do a full review, a free review, and make sure your plan is still the best for you. And Elon Musk kind of fits in this as well, because he's talking about, cutting trillions of dollars from the budget. Not exactly sure where that's going to happen, but considering, the biggest parts of the budget are Department of Defense, Social Security, Medicare. So even though Social Security is not, those are separate trust funds, but if you're going to cut trillions of dollars, not sure how you're going to get that without getting in those as well. And if Medicare Advantage is not changed to whatever Dr. Oz and the President-elect Trump was talking about, then More doctors. You've probably seen this in your local newspaper or local news. The local hospitals and the local clinics are dropping Medicare Advantage plans because they don't pay as well, and they pay late, and they delay, and they deny coverage. And some doctors and hospitals throughout the country are just completely fed up with Medicare Advantage, so they're dropping those left and right. So if Elon Musk goes in there and cuts that, and less payments to those Medicare Advantage plans that you have, then they're going to pay those hospitals and everybody less. And then you're going to be losing, the hospital or the doctor you like to go to. So I'm going to keep an eye on that and all of this, and I'll report back to you. And that way you can make a decision. And most importantly, reach out to your politicians and say, hey, I don't like this. I don't like this, the way this is going. I don't like the writing on the wall for this particular situation. We need to do this and not this. So this is participatory democracy, right? What about Musk and Social Security? Social Security is a humongous part of it. There's $2.6 trillion in the Social Security Trust Fund. If Social Security gets cut, the Social Security budget for the offices, the thousands of offices throughout the country, you're looking at about 1.2% of what they pay in benefits. So that's pretty darn good. 1.2% overhead for all of the staff and the buildings and electricity and all the rest of it. And it looks as though that's going to be cut back. So it's going to be longer waiting times to get in on the phone. It's going to be, you're going to miss your payments when when you want to go ahead and file. You might miss months because you weren't able to get in, you weren't able to get help. They messed up your case and you got an overpayment. That's all going to get worse already. But if Musk gets his trillions of cuts, it has to go through Congress and everything. But he's going to make the recommendation, and considering one party controls it all, they control the House, the Senate, the presidency, essentially the Supreme Court, then whatever he suggests just might happen. But I'm going to be here, and I'm going to watch everything like a hawk and make sure that even though Social Security is not helping your customer service, I'm going to teach you all the tips, tricks, and secrets I learned from decades inside that bureaucratic beast. All right, let's get back to President-elect Trump. So he promised not to touch Social Security, Medicare, but there's some out there that believe politicians when they make campaign promises, particularly this particular president. But I have to tell you this: no action means automatic cuts. So what kind of cuts we're talking about is you need to choose. There's going to be cuts right now. The cuts on the table, if nothing happens as of today, if we don't do anything, we don't take any action to save Social Security, then in 2034, your check is going to cut by 21%. And people think, well, I'd be grandfathered in. I wouldn't count on it. Maybe, maybe not. If some of the things that the president-elect Trump is thinking about passing in other areas, then we're looking at about a 33% cut in 3 years earlier, 2031. What am I talking about? Talking about no taxes on Social Security. And you may agree, I don't think there should be taxes on Social Security, but that brings billions of dollars into the Social Security Trust Fund. You can look at the Social Security Trustees report. I put a link in the description there. Look at that report, and you can see tens of billions of dollars come into the Social Security Trust Fund and pay for your benefits based on taxes paid. And we're talking about mass deportation. 27 billion goes into Social Security from people that pay into Social Security but will never get benefits because they're not in the country legally. No taxes on overtime, no taxes on tips. That's all great for the people that my mother was a waitress. I'm very happy about no taxes on tips, but that's going to bring less money into the Social Security Trust Fund. And so all of those things, tariffs, if there's tariffs, that's going to bring the price up, and that's going to be the COLA is going to be increased to kind of compensate for the increased inflation based on the tariffs. So all those things added together, several think tanks have run the numbers, and they said if all of that takes place, we're looking at about a 33% cut in your benefits in 2031. So you have to choose. Do you want to go ahead and just don't do anything and let it ride and get the 21%? Do you want to support all of these policies and get a 33%? Or do we want to do something different and get 0%? I'm all for 0% because I know through personal experience how many people really depend on Social Security. 40% of Americans depend just on Social Security alone. The people that are receiving Social Security, 40% of those just receive Social Security and no other income. So why I'm no longer optimistic about this is my personal, and I've been doing these live Q&As on a daily basis for months, and I've talked about this several times, and 99.9% of you viewers out there have chimed in that they think this one solution to save Social Security is the best solution, and that is the 365 days versus 17 second solution. I guess I'll call it that. Is right now, a lot of people don't realize you pay 99.9% of you people out there, me included, pay Social Security on every dollar we make 365 days of the year. Someone like Elon Musk or Warren Buffett or Bezos or whoever the case may be, they pay Social Security the first 17 seconds of the year, basically. Not sure about the calculation, but they only pay it this year is $168,600. After $168,600, you don't pay Social Security FICA anymore. You pay the Medicare part, but you don't pay FICA, the Social Security part. So we pay it all year long. The rich making millions of dollars only pay it for the first few seconds of the year, and they don't pay FICA tax anymore. And that is the solution that pretty much everybody out there agrees is the best possible solution to shore up Social Security. And why I'm not optimistic is because that idea is not even on the table. There's a whole bunch of other ideas: cut benefits, cut particular programs, spouse benefits, cut disability, put people on Medicaid, back to work, and disability back to work, and stop SSI, raise the retirement age. I personally believe, as we used to say in the Marine Corps, if I wanted your opinion, Ed, I'd give it to you. But I'm giving you my opinion. I don't, and y'all have given me your opinion. You don't want the retirement age raised. You don't want the cuts or anything like that. And 99.9% of you always said, yeah, why don't the rich pay FICA taxes like the rest of us? If we did that, we'd shore up Social Security for decades. All right. So, and that solution is not on the agenda of RFK, Dr. Oz, Elon Musk, President-elect Trump, the Republican Study Committee that came out with a study a little while ago, Project 2025. Anywhere out there on this particular side of the aisle, that idea is not on there. And obviously, you know why, is because, that means the rich is going to have to pay more taxes, and they definitely don't want to do that. So, all right, so I'm going to keep an eye on this for all of y'all. And when they appoint the next commissioner of Social Security, the current one resigned effective the end of this month, the 29th, I think, and they're going to have to appoint another one, and that is going to give a very, very strong indication of what they're looking at for the future of Social Security. If they appoint someone that just hates Social Security and wants it to be dead and gone, or given over to Wall Street and Medicare and all the rest of it, then that's going to be a strong indication of what we're looking at for 2025 and going forward. Okay. I did that in 18 minutes. Oh, I apologize. I took longer than I thought I would, and I want to get to as many of your questions as possible. As I said, my job is to make sure the Social Security Medicare is here for you and your kids and grandkids, but it's also my other part of my job is to make sure your current benefits are correct. All right, let's see here. If I work and live in Europe before I became a U.S. citizen and have disability support from my country, can Social Security cut my USA pension under WEP? Yes. The windfall elimination provision, it's determined on what type of pension that is. If it's a government pension, then probably the windfall elimination provision applies. There's the House just passed a thing where they were getting rid of that. I completely disagree with it, because if you watch my video on that, you know why that elimination of the windfall is there. But a lot of people don't understand it. They just think their benefits are reduced, and they're not reduced. They're just recalculated according to way 97% of people are calculated. So anyway, Dave, I am disabled. My ex is disabled. He is 68. Can I get some of his Social Security as an ex? Yes, if you're at least 62 years old, then you can get spouse benefits, but your benefits have to be less than half of his. and you say he's 68 years old, so he has to be at least 62 years old. He's 68, so you're good there. So yeah, call up Social Security and give them his information. If you don't know his Social Security number, no problem whatsoever. Just give them the name, the date of birth, as well as you know it, where the person was born, and they will look up his PIA, his primary insurance amount, and that's what the whole one half. They will look at your primary insurance amount, the benefit that would, you get at your full retirement age versus benefit at his full retirement age, and they will see if there's yours is less than half. If it is, they will set you up an appointment, and then you'll need your marriage certificate and your divorce decree to prove the 10 years marriage. You have to have 10-year marriage. So all right, Alan. Thank you, Doctor. You're welcome. You're welcome. If I'm going to retire in June of 2024, when should I contact? Oh, you're probably 2025. When should I contact either Social Security free website or your free website charter? So yeah, so if you're going to retire right out and you've been receiving health and care, health insurance from work and everything, and so you're going to pull the trigger on money and Medicare, then probably about 2 or 3 months before is fine. But remember to go into Social Security SSA.gov, set up a My Social Security account, and check your earnings. That's how they determine how much you're going to make for the rest of your life, is based on how much you actually paid in. And sometimes the Social Security records are incorrect. So you want to go in there and check your earnings to make sure they're correct. And then you can reach out to a chapter there, yeah, about the same time, 2 or 3 months. But you have to start deciding whether you want to do a Medicare Advantage plan or a Medicare supplement. I always say start with the Medicare supplement, see if that works for you, your budget and everything. And if it doesn't, then go to a Medicare Advantage. But Medicare Advantage takes more work, and there's issues there. But again, 40% of people choose, 50% actually choose a Medicare Advantage. I think it's more of a zero premium and the sales and everything of it. But Medicare supplement, please start there. And because it sounds like you're past your 65th birthday, remember that you'll also need, it's a form, it's a 564. The form 564, you take it down to your employer, and your employer confirms that you did have health insurance from current work since you turned 65. So if you're 66, 67, 70 right now, you have to prove that you've had credible health insurance to avoid that whole penalty, the Part B penalty, 10% for every 12 months. So do I need to sign up for SSD and Medicare every year? This is my first year. Is that sad? Need a priest of sad? You're probably SSD. No, you do not need to sign up for Medicare every year. If you got Part A, Part A covers the hospitals, Part B covers the doctors. And in terms of if you have a Medicare supplement plan, you really don't have to do anything. With a Medicare supplement, any time of the year, you can check to see if you can find a cheaper plan. If you're in a G and you want to find a cheaper G because they're all the same, it's just the price. Or if you're in a G, you want to switch to an N, or an N to a G, or an N to a cheaper G, a cheaper N, whatever the case may be. As long as you're healthy, and also depends on your particular state, you can switch that 365 days of the year. In terms of the Part D, for most people, you can only switch between October 5th, 15th, and December 7th. So we're very, very close to the end here. Medicare Advantage, same type of thing. If you have a Medicare Advantage, I highly recommend, checking your Medicare Advantage plan, once a year or so, and making sure, particularly this year, I really suggest checking it this year, because with the Inflation Reduction Act and the Part D prescription drug, where they reduced the max out of pocket from $8,000 to $2,000, Medicare Advantage plans and Part D plans throughout the country have changed a lot in 2025. And people tell me all the time, "Well, I've had the same plan for years." No, you haven't. If you have a Medicare Advantage or a Part D plan, those are only good for 1 year, and they expire December 31st. And the company, renews it, but they renew it with different details. You might still have the zero premium. You might still have the same doctor, the same Medicare Advantage card, the same company, but all the stuff under the hood just might have changed. So, you think you got a Corvette in the parking lot, and you wake up January 1st, and it turns out to be a 1972 Pinto. So, sorry, 1972 Pinto lovers. So definitely check that out. How much is the yearly deductible for Part D for 2025? I think 589 for 2024. Is it going to be 2025? Monthly bill went up. Yeah, the straight across most companies on Part D, they have their own deductible. So you definitely have to check your particular plan and see what the deductible is. So a lot of people just look at the premium and they say, "Oh, this is the cheapest monthly premium on this Part D," but they don't look at the deductible and the prices of the drugs and the tiers and all the rest of it. The prescription drug programs are just way way too complicated. Politicians stole all the money that belonged to us. That is incorrect. The Social Security Trust Fund is still there. $70 billion last year. I just did a video on this yesterday. So if we're going to solve this problem, we need to, kind of be serious about it and focus on the issues that really matter. And the money is still there. Um, this year, probably 7 or 8% of your check comes from the Social Security Trust Fund. So, and with interest. Still haven't got widow pay application put in August. Yeah, that shouldn't take that long. If you're talking widow pay, survivor benefits, if you applied in August, yeah, that I've done hundreds of thousands of surviving spouse claims, and it doesn't. It if you've got all the proofs, it takes like 5 minutes. So something is definitely wrong. I would reach out to that office. Thank you so much for your time and sharing your knowledge with us. You're welcome. You're welcome. Thank you. All right. Can my boyfriend collect that one-time $255 if his wife has been deceased for 2 years? They were married 20 years, but separated their last 4 years. Um, Separated, yeah, if they're not divorced, there's usually a 2-year kind of limit. If you get it within the 2 years, there's exceptions, though, but hey, it doesn't hurt to try. He would have to provide, the marriage certificate that he, married, and then if his name was, like, on the divorce or excuse me, on the death certificate or something like that. It's the 255 lump sum death payment goes to people that were living in the same household. That death payment is supposed to go for the funeral expenses and stuff like that. So I would definitely doesn't hurt to try. It's an easy application. I wanted to suggest how to increase a Social Security bank. Don't stop withdrawing money from paychecks at a certain point. Let those with more money pay more. It will all work out in the end. Yeah, so raise the cap. That's what I think should happen is everybody pays, FICA on all their money. But like I said, I don't think that's not on the agenda of the next administration. After getting a denial letter, got attorney filed for reevaluation. How long does it take to get a decision? So you did yeah. So you got your denial letter for probably a disability because attorneys don't take anything except for a disability unless you pay them up front. So you got a disability attorney and you filed the reconsideration, then SSA 561, which took the attorney all of 7.5 minutes to fill out. So, and if you're approved, he gets $9,200, he or she. So that's pretty good for 7.5 minutes of work. But it takes just as long as the initial determination, about 6 to 9 months, because Social Security is way understaffed. So I'm a veteran. How much more can I expect my payment to increase? Yeah, veterans, no relevance necessarily. Okay, you're probably talking about the uh, just a few dollars. You're talking about, but if you're getting veteran benefits, it doesn't affect your Social Security or anything. But you're talking about Congress has gives a little bit extra earnings, like $300 a quarter for years that you're active duty. And it's not very much, but hey, every buck is a buck, and it's your buck. So anytime you file for Social Security benefits, retirement benefits on your own record, make sure you tell them that you served in the military. If you don't remember if you did it when you first filed, call the 800 number, and they'll be able to tell you whether your military service was included in there. You might have to provide your DD 214. Are all drug formularies standardized, or does each plan have their own? Same tiers? No, they're all different. Yep, and it's crazy. It's crazy. Lost my retired Marine husband. Oh wow, hoorah! So if your husband was a Marine, then you're a Marine. Yeah. So that's why. If you saw my little title, I put former Sergeant Marine Corps. Yeah, you never get that craziness out of you. But anyway, so sorry about that. I lost my retired Marine husband last year, and I have TRICARE Select for now. I will be 65 December, then TRICARE for life. Will I need Medicare? Yes, I would reach out to TRICARE, but they almost always make you sign up for Part A and Part B. But that is your supplement. So I wouldn't get anything else. Don't let anybody try to sell you anything else like a Medicare Advantage. Some people get them, but with Medicare Part A and Part B and your TRICARE, you should be good. So just yep. All right. A writing campaign to our congressperson and senators should start now. Yes. And tell them, hey, we know what the direction y'all are going in 2025. And if you like it, then tell them, okay, keep going. If you don't, then tell them, I don't like it. Um, so thank you so much for all the do. I file under my divorced husband's now. Am I locked in with what we would get today, or would mine go up when he gets more over the years? I'm 63, he is 66. Yes, if you are receiving benefits off of your spouse's record, and you'll get COLA increases just like he'll get COLA increases every year. But if he continues to work and pays into Social Security, then that will increase benefits as well. So how it works, if you're receiving Social Security benefits and you're 70 or 80 or 90 or 100 years old, and you're working and you continue to work and pay into Social Security, and once you file your taxes, then with the IRS notifies Social Security, and Social Security looks at it and says, hey, this person made more last year. That's one of the high 35 years of earnings. So they kick out the low one, stick in the new one, and they recalculate your benefits, and then his benefits increase. And because his benefits increase, if you're receiving benefits on his, your benefits will increase as well. So it's a beautiful thing. Let's see. Divorced X64. He made 70,000 a year, but telling me his Social Security amount will be 2,300. How can I find the real amount? He never played by the rules. Yeah, so that's probably why. If he made 70,000, for 35 years, that it's not the full limit, but yeah, 2,300. It sounds about right-ish. Just kind of based on my decades of experience. But no, so if you're 62 years old, you can file for benefits on his record. So you have to file for benefits on your own record first. And then if his benefit amount is, if that's the 2,300, if 2,300 is twice your benefit amount, then you're entitled to benefits on his record, the difference between the two. So it's easy. It's easy. Don't trust him. If you don't want to trust him, call Social Security, call the 800 number, give him the information, his name, date of birth and all that kind of stuff. And they'll see if there's any more money. They won't give you the amount until, because they're not going to give that amount to some random person that calls up. You actually have to, they'll say, yes, there's more money on that record. Let's go ahead and schedule you an appointment. You go down there and schedule an appointment to take a spouse claim, and you have to provide your marriage certificate and your divorce decree, and then they'll tell you how much the benefits are going to be. So and I'm jumping around here. We got tons of questions. We only got about 30 minutes left, so I'm jumping around. I apologize if I skip your question. I'm not doing it on purpose. I just, whatever flies up, I grab one. Am I able to? Oh, speaking of, on Thanksgiving Day, as my attempt to heal your family, give the olive branch, those people that voted for one way or the other, you just don't like for whatever reason, on Thanksgiving Day, 2:00 West Coast time, was at 5:00 East Coast time. I'm going to do a 2 or 3 hour live Q&A. So I'm not going to do it a topic of the day or the news of the day. I'm just going to start off by answering all your questions. So reach out to those people that your family, and say, hey, grandpa, I don't like this, that, or the other, but you're still my grandpa, and I want to help you get all the benefits you're entitled to. Come on over here. Let's ask Ed. So I won't be there for Jerry Lewis 24-hour, but I'm going to do it as long as I possibly can. So am I able to qualify for a supplement plan if I have a pre-existing condition like cancer? It really depends on your particular state. If you're 65, then it doesn't matter. They can't deny you. But if you're after your initial enrollment period, it depends also how long ago. Some companies on Medicare supplements, they have a 3-year look back. Other ones have a 5-year look back. It depends on, the status of your cancer diagnosis right now. So it doesn't hurt. Reach out to Chapter, and they can check, and they'll ask you some questions. They know all the company. They work throughout the country, and they know, in your particular state, this company is, they only look 3 years. This one looks 5 years. So yeah, definitely check it out. It doesn't hurt to try. Thanks for taking those picks away. I was trying to keep my lunch down. Nice. More hospitals will close. Yeah, it's pretty sad. A lot of the rural hospitals are having a hard time, and a lot of those are closing down. So if you're on, and they're having a hard time getting doctors and primary care physicians, and yeah. We can rarely speak to anyone at the Social Security offices without a long wait time or appointment. Yeah. And they just changed it. I just did a video a little while ago, starting January 6th. Not sure why they chose that particular day, but starting January 6th, you pretty much have to have an appointment. There are exceptions, but because of the staffing, they decided to go to an appointment only situation. And they've been talking about that for decades. When I worked at Social Security, they were kicking around. I always said, no, 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 don't. Yeah, don't go with appointments, because it's counterproductive. It's going to make everything worse. It's, good if you can get an appointment, you don't have to wait, but unfortunately, overall, it's going to hurt even more, and customer service is going to be worst. So worse, excuse me. But if they limit how much doctors get paid, you may also see doctors not accepting Medicare patients. That is a fact. That is 100% a fact. So, well, Medicare, I think pretty much doctors' original Medicare, yeah, 95% of people take, Medicare rates. It's those Medicare Advantage plans that really hurt, because if you don't take Medicare, then yeah, doctors have a hard time, keeping a business themselves. And, these rates, RFK Jr. is also talking about, it will also possibly affect the Affordable Care Act, because if he's going to be in charge of HHS, it's not only going to be he's in charge of Medicare, he's also in charge of the Affordable Care Act, Obamacare, marketplace insurance, whatever you want to call it. He's also in charge of CHIP, the Children's Health Insurance Program. So if he changes rates across the board, and makes it cheaper, then I guess that's okay. But yeah, but then what happens if you've got, let's say if you got Medicare, they pay $100 for this one. And the Medicare Advantage plan, they have to make a profit, so they only pay $90 because they want that $10 profit. So those are the ones that are having the issue. So, yeah, it's all complicated, but yeah, it does affect your pocketbook, unfortunately. I pay more for healthcare with Part B and the Plan G than I ever did while employed, and I make far less income. That is sad. Yeah, some people, when they, again, Medicare supplement, I wish everybody, if everybody got a Medicare supplement, then it would bring the economies of scale. It would bring the prices down for everybody. But unfortunately, that's not the system that we have today. Um, and some people, unfortunately, they do the right thing, which I encourage. Get a Medicare supplement, a Plan N, and a Plan G. But some people, after 5 years or 10 years or 20 years, just can't afford the monthly premium anymore. So they switch to a Medicare Advantage plan. So there's that. Yeah. Clearly, we're not being told the truth about Medicare Social Security benefit cuts to come. Yeah, regardless of who was going to be president next time around, whether it was going to be Vice President Harris or President-elect Trump or whoever, at some level it didn't matter, because we've been told for decades that the Social Security Trust Fund is running out because we're giving it to the baby boomers they saved up for that. Now we told them, hey, we're gonna take, we're Social Security for decades up until 2010 brought in more taxes than they paid out. And they said, we'll put this in a trust fund, get interest, and once you get older, it'll be there. But the problem is, two things happen. They didn't calculate how much the birth rate would go down, and they didn't calculate of how much money would go outside of being taxed by FICA. When they started these numbers, 90% of income in America paid into FICA. Now it's 81%. So that 9% that's why the trust fund is running out sooner than it should have. And it's not because it was stolen or given to these people or given to that people, incorrectly. It was just because of those miscalculations. All right. I am currently disabled and I'm 59 years old. I currently receive SSDI. If I retire at 62, would the same amount I am currently receiving under SSDI stay the same amount received under retirement? No, you would get about a 30% cut. So don't do anything. If you're on SSDI, what I recommend is if you're on SSDI at 60, you're eligible for survivor benefits. So if you were married to anybody that passed away, check for survivor benefits. At 62, you're eligible for spouse benefits, current spouse benefits, divorce spouse benefits, independently entitled divorce spouse benefits, and you can still get your disability. A lot of people think if you get surviving spouse benefits or spouse benefits, that's going to stop your disability and therefore it's going to stop your Medicare. That is 100% incorrect. You can get disability, continue to get your Medicare, and get surviving spouse benefits and get spouse benefits. One offsets the other, but you can add those on top of there. And then, so 62, check for spouse benefits. When you hit 65, check to see if you want to switch to a Medicare supplement plan. When you hit your full retirement age, you're no longer on disability benefits. You're on just regular retirement benefits. They stop taking your money out of the Social Security Disability Trust Fund and start taking out of the Social Security Retirement Trust Fund. So your check and everything stays the same, but you're no longer limited to how much you can make, and you no longer have those continuing disability reviews. So you are completely free. So it's a beautiful thing. All right, let's see. Again, I'm picking these at random. Whatever pops up on my screen, I push the button. Last week, you hinted about a trial work period of 9 months before SSDI turns to Social Security at FRA. I investigated this for my brother and found that the cutoff age for this is 64, well before FRA. The trial work period, yeah, unless they change the law, you have a trial work period, which is a 9 month. It's not necessarily consecutive, that you can work and make as much as you want. And then once you finish your trial work period, those 9 months, then it switched to 36 months, the extended period of eligibility. Unless they change something very, very recently, not sure if the Supreme Court is going to get involved in that because now there's, Social Security can't make their own decisions. So thank you for, not sure who you checked it out with, but I will double check that and I'll let you know. I appreciate that. Doc, you can't ask us if we want to do this or that. The Trump and the Trump Congress will decide what happens now. Yeah, then we're kind of giving up, the idea of a participatory democracy. I told you I was optimistic, right? I'm still kind of optimistic. I think if we push our politicians enough, then maybe I don't know. So, you are snared by the words of your mouth. Oh, what the heck is that? Okay, don't know what that is. It's only the richest country in the world could do such a hatchet job, and the people who worked paid their dues. Yeah, it's a lot of other countries got their Social Security all set up, and you call the Social Security office, and they immediately pick up the phone and they give you the right answers. It's also not as complicated as the United States Social Security system is. Again, over 20,000 pages, exceptions, exceptions, exceptions. So all right, let's see. I paid Social Security for the 35 years that I worked. It is upsetting that the government plans to take that money. I worked hard for all the years I worked until I became disabled. Yeah, that's that they're talking about those cuts. And again, if they don't take action, those cuts are automatically going to happen, 21% cuts. And, effectively, there's a cut happening right now because when you paid that FICA for those 35 years or more, part of the deal was when you were going to retire, Social Security Administration was going to help you. An employee was going to help you make sure you get all the benefits you're entitled to. And that kind of has fallen through. So yeah. Let's see here. I've got a lot of people are not very happy with the current situation and what's going to happen next year, and I understand 100%. But let me see if I can find questions about Social Security, see if we can find you some money. I'm disabled person that's only 51 years old, and I qualify under widow's benefits in the state of Georgia, but is taking forever. My SSI has not been approved for over 2 years. Okay, so it sounds like you're filing for disabled widows benefits. Disabled widow benefits is you're disabled, you're a widow, obviously, and from 50 to 59 years old. A lot of people miss that. Regular old widows benefits, widower benefits, surviving spouse benefits, whatever the case may be, um, you have to be 60 years old. But if you're disabled, then you can get them between 50 and 59 years old. The state of Georgia, I know Savannah, Georgia, I did a video a few months ago about the worst places in the country to become disabled because it takes so long. Savannah, Georgia was number one of the worst place in the country because it takes so long. So maybe you're around that area, but it hasn't been approved for 2 years. Yeah, that's it sounds like the initial decision probably 6 to 9 months. Then you do the reconsideration. It sounds like you're possibly waiting on an administrative law judge to make that decision, and Georgia is the worst, unfortunately. But that changes on a regular basis to what Social Security does. My office did it, and when our state was kind of backed up, we had workload mobility where we could send it to another state. So hopefully Georgia did that and send it to another state that has some capacity to help out. But I would reach out to Social Security or the Administrative Law Judge Office or DDS, the state agency, and say, hey, what the heck is going on? Why is it taking so long? And reach out to your politician, your state, your senator, your federal senator, and the House representatives, congressperson that represents your particular district. And on their websites, they have a little button you push that says, I need help with a federal agency. You click that, you fill it out and say, I'm not happy having to wait for 2 years. What are you doing to improve the customer service at your local office? So I think that's one of the tricks that we can do is, we should focus nationally, but we should also pressure local people, local politicians, our local representatives, and say, hey, this Social Security is right down the street from your office. And have you driven by there at 9 o'clock in the morning? You see the line. Have you called them? What are you doing? Politicians love to go out there and, in their funny, hard hats or with their big clown scissors and, cut the ribbon for some bridge or, thing that they brought to their district. Well, take your funny scissors and go down to the local Social Security office and make that customer service better. And if everybody did that, customer service would get better. And I wouldn't have to do these videos anymore and I can go back into retirement. So, but I don't think that's going to happen anytime in the near future. So, the more money that some people get, the greedier they become. The rich as a group will never agree to pay more. Ruthless business acumen. Yeah. So, let's see. All right. Currently 68 on Social Security, approximately $1,800 a month. Was on SSDI. Am I eligible for SSI? If so, how much I might get? SSI, no. SSI is Supplemental Security Income. That's the welfare-based program. The max you can get this year is $943, and because you're receiving $1,800, that's more than $943. So you cannot get SSI. But I did a video on Saturday that living on Social Security alone, and I went through about 50 different programs that might make your life easier. So make sure you watch that and share that video. Please share this video. Like and subscribe and share. That way this goes out to more people and hopefully more people will get help. All right. Ed said supplement if you can afford it. And if not, Medicare Advantage. Correct. Yes. And remember, on affording things, look at it in the long term. So you're like, okay, Medicare Advantage is zero premium. A Medicare supplement plan G in my particular area is, whatever. Then you don't look at it necessarily just like that. You say, okay, well, if you get sick in the future, how much is it going to cost me? Because a Medicare Advantage plan might be zero premium, but they kind of nickel and dime you as you go. It's a pay-as-you-go type system. $100 per night for a hospital, $50 for that, $75 for that. If you are going to live the next 50 years and you're never going to get sick or fall or be injured, then 100% I recommend a Medicare Advantage plan all day long. If you can look into your crystal ball and know you're never going to need it, zero premium, absolutely. But what do they say? Life is what happens while we're making other plans. So, all right. Different places like hospitals take different Medicare Advantage plans. Yes, that's one of the things that you need to check out. And be careful when you check your Medicare Advantage plans if your doctor or whoever takes. Some people They don't realize Medicare Advantage, you have Medicare Advantage XYZ company in your area. And XYZ company has maybe 6 different versions of their Medicare Advantage plan. They've got, maybe you've got your old version, the old Pinto that you think is a Cadillac, but it's not anymore because they've upgraded it and they didn't tell you because they want you to stay on the old plan so they make more money. These guys are smart. Um, but when XYZ company, you call up your doctor or something and you say, "Hey, do you take XYZ Medicare Advantage plan?" "Oh yeah, yeah, we take XYZ." Do they? Do they take all of XYZ's Medicare Advantage plans, or they take 3 out of the 5, or 1 out of the 6? So it has to be your specific plan, because sometimes doctors take one version of the plan, but another version of a different plan for the same exact company. So that's another reason why Medicare Advantage is kind of, it takes extra work. With a Medicare supplement plan, you don't have to ask that. All you do is call and say, "Hey, do you take Medicare?" "Yep, we take Medicare." "Okay, done. End of story." So if they take Medicare, they have to take whatever Medicare supplement plan you have. Let's see. That will be interesting because the clinic and hospital here, which is a Mayo, will not take Medicare Advantage. Yeah, the Mayo Clinic and some other, yeah, are not taking Medicare Advantage anymore. My wife has Medicare, Medicaid, but still pays the premium. Is this right? Should she change to an Advantage plan? Um, it really depends on the level of Medicaid. So it sounds like she has a lower level of Medicaid. So the higher level of Medicaid, the QMBs and the QIs and the SLIMBs, it depends on your state. They're all a little bit different. They pay for your Part B premium. It's called the Medicare Savings Program. So she might not have the higher level of Medicaid. So number one thing, I would call and say, "Hey, can you upgrade my Medicaid so you pay my Part B?" And if they say no, then yeah, then you have to pay your Part B premium yourself. But you you can still get a Medicare Advantage plan. If it sounds like she probably won't be able to get a Medicare Advantage dual eligible plan because she has a lower level of Medicaid. And those are the Medicare Advantage dual eligible plan. Those are the ones you see with all the, those crazy advertised grocery carts. They do exist, but the way they're advertised is I think really, really scammy. But yeah, she should have a Medicare Advantage plan if she's got Medicaid. If she's got Medicaid, she can't get a Medicare supplement plan because they can't sell her a supplement, but she can get a Medicare Advantage and see if she can get some extra benefits there. So you can reach out to my partners at Chapter and they can help you out. I opted out of Part B 9 years ago. I have been covered by veteran medical health care for 23 years. Am I still subject to 10% annual penalty if I want to add Part B? Yes. That's why I always tell veterans, be careful. People say, "Well, I don't want to pay Part B. I don't want to pay that monthly premium because I have the VA and I like the VA and it's all awesome and stuff." And then several years later, it's not awesome anymore, or they want a second opinion, or they move. So, but there's a solution. Unfortunately, not for you. You're going to have to pay the 10% for every 12 months you did not have Part B. But the reason you didn't get Part B is because you didn't want to pay that monthly premium. But there is a solution for those people that are in your same situation, unfortunately, 9 years ago, is that there's a Medicare Advantage Part B give back type of plan. So what it is you sign up for the plan, and the Medicare Advantage plan pays for part of your Part B. It depends on your particular area. They might pay $50 of it, $100, or all of it. So if there's one available in your area, again, reach out to Chapter and they can see if there's one available in your area. But a caution on that: health insurance companies, they don't get to be $1 billion, giant corporations for nothing. They're smart. If they're going to pay $100 of your Part B premium, they're going to take it out of some other place. So like a regular plan for that company, might charge you $100 a night if you go to the hospital. If they're paying for your Part B, they might charge you $200. So that's how they make up the difference. But if you use the VA clinic most of the time and you just want to have your Part B as a kind of a fallback, then that's a good option. And some of those plans are actually called, because veterans use those, they're called Patriot plans or Honor plans and stuff like that. So, all right. My ex-husband died last year at 63. He was on Social Security disability. When I collect survivor benefits, do I click what he was getting on disability? If you are your full retirement age, then yes. Yep. If you are your full retirement age, then you'll get 100% of the benefit he was receiving. Compare Part D plans online and look at the drugs you take. Yes. And yeah, Medicare.gov has a good site for Part D. And yeah, yeah, you really have to be perfect when you do it. 30-day supply is, it's more expensive than a 90-day. Extended release sometime is, more than this. A capsule is more than a tablet. It's crazy. Yeah, the whole thing is, yeah. Anyway. Husband and I started taking Social Security at 70 years old. Is it safe to retire? Is Social Security likely to last through our lifetime? As I said, I've always been optimistic. Every time people have been telling me, it's going to be, is it going to be, it's not going to be around, it's not going to be around, it's going bankrupt. Yeah, and I'm like, come on, no, it's not. It's not. But now I'm not as optimistic as I was, not because the next president is whoever that person is. It's because we waited so long. We've known about this problem for 20 years that we need to do something because of those demographics and the money going to the top, the cap and everything. But we refuse to do anything. So it's just going to be cuts. And yeah, unless something has happened. So, all right, let's see. Donna, I automatically got A and B when I turned 65. I got it without applying. Would that be the case for you? Yes. So if you're currently receiving Social Security monthly benefits and you turn 65 years old, Medicare will automatically send you your card in the mail. You don't have to do anything. You'll get your Part A and your Part B automatically. If you're not receiving Social Security monthly benefits, then you do have to sign up manually if you want Part A and Part B. So you can restrict it. So you can say, okay, I just want Part A. I just want Part A and Part B, but no money. I just want Part A and money. And if you're under 65, you can just, I just want the money and then get, Part A or Part B later. So you can restrict your application to different things depending on your particular situation. So you can refuse Part B. So if you receive that card in the mail automatically and you're currently working and have health insurance from work and your employer has 20 or more employees, then you just basically return the card and say, I don't want Part B, but you have to continue to get Part A. That's free anyway. It's zero premium. It's not free. You got deductibles and everything, but it's zero premium. Is there any stimulus coming for people collecting SSI? No, there's so much clickbait out there about stimulus, and yeah, that's probably the biggest clickbait thing out there. The stimulus clickbait and the $2,000 grocery card and free ice cream and unicorns for life. Yeah, what those are is Medicare starting October 1st said you can't advertise those. If those if you reach out to if there's a grocery card that has $2,000 in, let's say, Tampa, Florida, you can advertise on Facebook or YouTube to people in Tampa, Florida, that there's a $2,000 grocery card available, but you can't advertise to the rest of the country. But that's what these health insurance people have been doing, is advertising to the entire country. And you call up and say, hey, I want me some $2,000. And they say, do you live in Tampa, Florida? And say, no. Then they try to sell you something else. That's what's called a bait and switch, right? So they can only advertise what's available. So if you want to find out if there's one available in your area, reach out to my partners at Chapter, because those are all tied to Medicare Advantage plans. So, all right. You are not a former Marine. Once a Marine, always a Marine. Hoorah. Yes, Semper Fi. That is a fact. That's why I put scare quotes on that. So I think having socialized medicine is what U.S. needs. Like Canada, it's bullying the way they change plans all the time. It's unfair when people have to go without insurance too. Yeah, that's actually what Dr. Oz is talking about. He says Medicare Advantage for all. So that's his Medicare, his universal health care. Okay, but it's the details that's important. So step in the right direction, health coverage for everybody, but the current state of Medicare Advantage, yeah, you got to rethink that part. Oh, let me. Sorry, Imaginator. I've got tons of questions here. Oh my God, wait a sec. All right, I am 65, living outside the U.S. and on a private insurance plan. Do I still need Medicare? Um, it really depends on your type of situation. If you're, with an American company or something like that, there's an exception possibly for you. Uh, I am 49 and have had 19 surgeries and I'm consistent pain right now. Yeah, yeah, 49. I would definitely, if it sounds like you're having a hard time, I would definitely file for disability benefits. I did a series of videos, 3 videos on filing for disability, all the tips, tricks, and secrets I learned. So if you're looking to file for Social Security disability benefits, watch those videos and apply as soon as possible because it takes way, way, way too long to get a decision. I'm 77, a widow, married 48 years, worked with him 48 years, but no paychecks for me. If I go back to work and earn more than in 35 years for either, will that amount go to my Social Security benefits? I've had cancer for 13 years. Um, yeah, that's like one of the very first videos I did when I started YouTube is about this type of situation where husband and wife has the business, and unfortunately, one gets all of the Social Security type benefit they're put on them, and which was fine if you're, but if you're collecting widows benefits, it sounds like if you're 77 years old and you didn't work that much, if you pay into Social Security, your benefits on your own record doesn't sound like it's ever going to be more than what you're receiving from survivor benefits. So, obviously, I'm not telling you not to, go make some money and go to work or whatever. If that's what you want to do and you're able to do it, then yeah. But it doesn't look like it's going to increase your monthly Social Security benefit because if you're making, $2,000 or $1,500 from survivor benefits, and your benefit is $200 a month, and then you work, and next year it's going to be maybe $250, and then the next year will be $300, and so it's never going to be probably what your surviving spouse benefits are going to be. So there's that. All right, I have got way, way too many questions, and we are out of time. I sincerely apologize. Again, I will be back again tomorrow and answer more of your questions. But remember, Thanksgiving Day, I'm going to do a 2 or 3 hour